Pedophilia is a paraphilic disorder defined by a recurring and intense sexual attraction to prepubescent children, usually aged 13 or younger. It is a psychiatric diagnosis distinct from the criminal act of child sexual abuse, although many who commit these crimes meet the criteria for the disorder. The disorder is overwhelmingly found in males and is often accompanied by other mental health issues such as depression or substance abuse. Pedophilia is not a lifestyle choice, but rather a disorder of sexual preference, often developing before or during adolescence. Symptoms and diagnostic criteria. According to the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, a person can be diagnosed with pedophilic disorder if they meet the following criteria. For at least 6 months, they have had recurrent and intense sexually arousing fantasies, urges, or behaviors involving a prepubescent child. The individual is at least 16 years old and at least 5 years older than the child in their fantasies or urges. They have either acted on these urges or are experiencing significant distress or impairment in their functioning, social, occupational, etc. as a result of them. A person can have pedophilic urges without being diagnosed with the disorder if they do not experience significant distress and never act on them. Causes and risk factors. The exact causes of pedophilia are not fully known, but research suggests a combination of factors. Neurological factors. Some studies have identified structural and functional differences in the brains. Pedophiles, particularly in areas related to behavior control and sexual arousal. Neurodevelopmental factors. Some research indicates that pedophilia may be associated with increased rates of head injuries in childhood, lower intelligence, and specific differences in sex dimorphic brain structures. Environmental and psychological factors. A history of childhood sexual abuse and dysfunctional family dynamics have been cited as potential contributing factors. Learned behavior models suggest that victims of abuse may become conditioned to repeat similar patterns. Hereditary factors. There is some evidence to suggest a small genetic component, as pedophilia appears to run in some families, though the precise mechanism is unclear. Treatment and management. Currently, there is no known cure for pedophilia. Treatment focuses on managing urges and fantasies to prevent offending and address co-occurring mental health issues. Cognitive behavioral therapy, CBT. This is a primary psychotherapeutic approach that helps individuals recognize, manage, and prevent risky behaviors. It often involves relapse prevention, teaching patients to identify high-risk situations and develop coping strategies. Empathy training, helping individuals understand the harm their actions cause to victims. Pharmacological interventions. Medications are used to lower the sex drive and manage urges, which can make therapy more effective. Common options include anti-androgens. These drugs, sometimes called chemical castration, suppress testosterone production and reduce libido.SSRIs. These antidepressants can help reduce obsessive sexual urges and manage co-occurring depression or anxiety. Important considerations. Treatment effectiveness depends on the individual's willingness to engage. Many pedophiles do not seek clinical help due to legal and social stigma. Some pedophiles never act on their urges, and treatment can help prevent this outcome.